Many times as doctors, we are not going to know whether our patients are ever going to come back. As residents, I think that that's more true because you're less available to them than you will be when you are practicing medicine. I think the best thing we can ever do for our patients is to be genuine with them and to enter into moments as they present themselves as genuinely and sincerely as possible to make them feel that the time that they spent with you is worthwhile.
I guess the easy answer to that and the quick answer would be to, do what the patient is asking you to do for that one visit. Sort of a longer answer is usually I try to establish with the patient up front if they are going to be just coming for the one visit or if they intend to follow up and do more visits, and that will help me figure out what I need to do for that particular visit. So if they tell me, no, I'm really not going to come back again, this is just the one time, then I'm not going to do any tests that require any kind of follow-up because I know that I won't be able to get the answers to them or get the results to them. So I'll try to do whatever I can in that one visit to address what I can, and then that'll be it. And sometimes, if I can't do it in that one visit, I might tell them, well, this actually requires some follow-up. This problem requires some follow-up. Can you come back, or can I refer you someplace else that might be able to do the follow-up, or can you go to an emergency room or to an urgent care center? So it depends on what the capabilities are also in your particular clinic. But say I wouldn't go into any like laboratory tests where they would have to come back next week to get the results or anything like that, if I could avoid it.
Patients will come for STD testing and they don't have a phone number or an email address. And I explain to them, it'll be 2 to 3 days before I get these results. It's really up to you to come back to get the results because I don't have a way of reaching you. And just being very forthcoming with them.
I might mention, if it really would be good to get the patient to come back and follow up, I might mention that, if you were willing to follow up, we could do this, this, and this for you. If you wanted to follow up with us, I would be happy to do those particular interventions or tests. And maybe after spending some time with the patient, they might trust you more, and maybe they would be willing to come back again.
In my experience, most patients who are in the wind will probably continue to be in the wind, and they are more likely in those moments that things settle to come back to someone that they felt like listened to them, they felt like made a connection with them or attended to the problems that they had and didn't try to bring their own agenda into it. It's a little bit different if you're dealing with a child and the parent is in the wind, and the child is not getting adequate care as they're growing up because their parent isn't present on a regular basis. In those situations, because your patient is the child, sometimes addressing it a little bit more directly and explaining to the parent, it's really important that they follow up. Work with them directly on establishing barriers. So why did you miss that appointment, or why is it hard? I have many patients who have become homeless in the time that I've cared for them. And in New York City, when you become homeless, you're sometimes placed in a different part of the city. So my office is in the Bronx, they live in Queens or they live in Brooklyn. It takes 2 hours for them to get to see me. And if they don't understand the relevance of why they have to come see me, it's a burden for them. So sometimes the best thing I can do in that situation is, first of all, identify that barrier, and second of all, try to find them a provider that's closer to them. The bigger challenge that you have is when a parent is saying like, no, I really want to keep seeing you, even though you suspect that maybe they're not able to do that. There are ways that you can work within the system to identify different resources for overcoming those barriers. Sometimes in New York, we can arrange for transportation or provide transportation vouchers, things like that. But I think the general principle is identify what the barrier is, and then try to be as direct about it as possible.